hip pain is a term that describes pain. It's just like headache. Where do you feel it? You feel it either in your groin, at the front, on the sides, or towards the back. This is what hip pain is and where it comes from. Hip pain can come from different areas. It could be part of a whole general disease that affects all the joints in the body, or can be specific. And being specific, it could be more subdivided into areas according to the age. The most common in someone who is growing up is called slipped femoral epiphysis. This is a condition that causes hip pain. The most common afterwards, when you're growing up, is muscular, a strain while you're doing sports-related activities. When you get a little bit older, the most common is arthritis, which is wear and tear of your hip joints. So these are the most common things that can cause hip pain. If someone comes to me and says, what does it mean that I have sudden hip pain and I cannot walk? Well, it can be a number of reasons. The most common is that you've had a sprain in your hip following some exercise. If you look at the elderly population or people, this could be because of increase of the hip wear and tear suddenly, and that causes inflammation and causes you to have pain there because of the fluid inside the hip joint. It can also be something more serious, such as an infection inside the hip, or if someone who is growing, that they have a problem with their cartilage that is moving. So if you don't have sudden hip pain and you cannot walk, what I would recommend is to seek medical advice through your GP or through accident and emergency. If you have back pain together with hip pain, together with knee pain, this is not uncommon. It could be part of a general disease, such as rheumatoid arthritis, or to be specific, it could be that one of the joints having an effect on the other. Such it's just the low back together with the hip, together with the knee, are like a domino or a train connected to coaches. If one goes, the other follows. And bear in mind that the hip and knee are supplied by the same nerves. So you would feel one and the other. If you do have a multiple of hip, knee, and back pain, we have to identify where this is coming from and which one is causing the knock-on effect for the rest. This is what causes hip, low back, and knee pain. The exercises to do at home to help with the hip pain are mainly something called isometric exercises, which improve the tone in the muscles, but not the actual bulk of the muscles. It's very difficult for me to go through each one of them, but if you go onto my website, you can download information about these exercises that you can do day in and day out. A lot of times people ask me, how do I know that my hip pain is serious? What you have to remember is that if you wake up with severe hip pain and it does not go away, taking simple painkillers, you ought to get medical opinion and advice. You can go to your GP, who can go through the history, examine you, specifically find out where the hip pain is coming from, and then get investigations to find out why you have hip pain. I would not recommend that if you have persistent hip pain, leave it, because it can be serious. Thank you.